Delighted to say Labour's Shadow Minister for Education, Bridget Phillipson, is joining us on the programme this morning. Very good morning to you. Happy New Year.
Good morning. Happy New Year.
Look, lots of eyes on the school gates this morning. It's going to be a very different scene as pupils go into the classrooms. What do you make of how Nadeem Sahawi has set us up for the spring term so far?
Look, it's really important that children are back in school learning and playing together. It's so incredibly important, and, you know, they have missed so much time already, so it's really vital that they stay in class. I think what we've seen from the government, however, doesn't put in place what's needed to make sure that we keep down the transmission of COVID within schools. So, you know, before Christmas, we were saying that the government should use that break to roll out the vaccine to all eligible children. It's been a huge missed opportunity to do that. We also need to see proper ventilation in our schools. Head teachers are being told just to open the windows and put children in coats. I don't think that's good enough. And on testing, you know, we know that many parents have experienced difficulties getting their hands on testing kits, and it's vital that we all test our children to make sure that we're kind of keeping control of the virus.
Well, we know what's wrong, Bridget. What would you do to put it right?
Yeah, firstly, we would make sure that there was proper ventilation in every classroom, so we'd take decisive action on that. Secondly, where it comes to the vaccine, we would have made sure that over Christmas we had walk-in clinics so that all eligible children were able to get the vaccine as quickly and easily as possible. And third, we've seen a lot of misinformation around about the vaccine. It's really important that we tackle that, but also that we stop people hanging around school gates, peddling misinformation to parents and also frightening and alarming children. So that's some of the measures that we would be taking right now to get on top of things. But longer term, you know, we need to make sure that our children see a proper recovery from the pandemic. So we've got a really ambitious, costed plan around making sure that children do have that recovery from all the time that they've missed out of class.
Tell us more about how you would deal with parents, how you would bring them on side, because we all know there's a lot of parental resistance to vaccination.
I think it's really important just to reiterate that the vaccine is safe and effective, and that obviously if we get vaccine rates to a higher level, it will make it easier to keep schools open, to keep children in class and to drive down transmission. My experience, I have to say, is that I've heard from lots of people that they want to see their children vaccinated, but actually getting an appointment hasn't always been very easy. I think we need to see more around walk-in clinics, around pop-up clinics in schools, just to make it as easy as possible for children and parents. I think access is as much of an issue as misinformation, but I just would reiterate the vaccine is safe, and it's really important that we all take it up when it's our turn.
Bridget Phillipson, there is no scientific consensus on whether or not children as young as 5 should be given the vaccine. There is agreement in the over 12s. There are some countries, many countries in the world, who are vaccinating primary school-aged children. But as I say, there's no unified consensus on that. It's very confusing for parents, and obviously they're very concerned when they're making decisions for somebody else. Where do you stand on that?
Of course, and parents want to have all the information available and in front of them. I mean, we have seen the government announce that children who have particular health conditions or those who live with those who do will be eligible for the vaccine when they're aged 5 to 11. But where it comes to children already that are eligible, so the over 12s, it's only around half who've been able to take up that vaccine. I don't think that's good enough, and I think we should really redouble our efforts on it. But where it comes to rolling out the vaccine more widely to other groups, we'll be guided by the evidence on that, and I hope the government will be putting forward what the position is in due course.